All right, we are going for a quick trip to the supermarket. I'm going to run some errands on this Friday. It's the middle of, what are we in, May? So I guess we're like really at the end of May before Memorial Day. So I haven't had a chance to make a lot of videos like this, and I'll be honest, guys, it's because every time I try, my phone rings, I get really sidetracked with the phone beeping, and it's just not as easy as it used to be because it's a lot more time spent in the office, and I sort of figured out how to manage my schedule, 2.5, 3 years into practice, which is something that for you younger chiropractors and chiropractic students, if you see this, when your mentors are trying to tell you something when it comes to business that has really been a difference maker for them, don't be like me when I was young and be like, well, I'm going to do all these other things my way because I'm so smart and I'm such a great adjuster. Listen to what they are saying, cluster book, be busy on the days you're in your office. If not, don't go in. Go out, network, market, work on yourself, get fit, do good things. It'll come back to you. Don't just lollygag and sit around your office for nothing and make, 2 hours of content for one video. All right, I digress. So let's have a serious conversation, people. Let's talk about what needs to be talked about. I think a lot of people out there feel like they're in pain because they're old, or, oh, once you get old, you're in pain. Oh, just getting old. No, stop. Please stop. Really stop. It goes like this. As we age, our tissue becomes less resilient. It is a scientific proven, not theory, it's a fact. It is why we degrade. It is why, as we age, we are more vulnerable to injury. It is why our tissue deformation is worse. It is why our ligamentous laxity is not like it used to be when we were young. We don't have the vascular, we'll call it vascularization and blood flow to the muscles and tissues that we once had. And we need to work quadruply hard to try to maintain and enhance what we do have, which is why supplementation, consistent exercise, very good nutrition, so forth and so on, is so vital as we age. That is why there are some 40, 50, 60, 70-year-olds out there that are in phenomenal shape and don't have the problems that most common Westerners, like most us common folks who like to eat sandwiches and bags of chips and having dessert and alcohol, 4 days a week, and acting like, there's some other secret as to why we're getting fat and out of shape and always hurt and why we're always sore and why we seem to have all these autoimmune conditions. Okay? That's just the facts. We know why we feel the way we feel, and if we don't, it's because we're just simply not honest with ourselves. And people, please understand that if you are seeking chiropractic care to help reduce pain, and it is working even for 20 minutes after your appointment, it's working. Whether or not you have a chiropractor that you feel comfortable with and you haven't found the right dose response to your physiology, how often the frequency or the patterns of adjustments that you get your spine checked and you have the subluxation patterns that you get adjusted, and the way your chiropractor goes about adjusting you to where you feel stable, to where the adjustments feel like they're holding, as I don't like to use that phrase, but I can't think of a better one. So the adjustments are holding, chiropractic is working, you're doing more exercise, you're figuring out a way to stay stable, you're eating a less inflammatory diet, you're not doing certain movements that compromise the reason you have joint pain to begin with, then you're going to eventually get stable and you're going to feel good, and the payoff is real. So that was kind of a real unorganized way to state you're hurt because you're going to be hurt if you don't start doing things right to take care of yourself. Because you have a resilient body with resilient tissues that happen when we are, teenagers and in our 20s, and it's why almost everybody fits this pattern typically. That's why it's not like atypical, it is very typical to actually be getting fat and pudgy and start having insulin resistance in your late 20s and early 30s. It is why when you finally maybe tear your ACL, playing basketball, even though you've been potentially doing the same motion for 20 years, that maybe in your mid 30s, late 40s, whatever the age range might be, that you finally land on your leg the wrong way and the thing just pops. That's why, I don't need to go on with the examples, and I'm not going to. All right, I'm here. I'm going to run my errand. Maybe this thing makes it out. Maybe it doesn't. I don't know. See you guys.